Or if you haven't had that joyous experience, how many of you can remember going to the dentist yourself as a child? See, you can empathize then with Tommy, who has a toothache.
Fictional character.
Yes, fictional character, in case it wasn't apparent from the animation. Tommy's had a toothache for 2 weeks, and he hasn't told his mother about it. And the reason he hasn't told his mother about it is because his last experience with the dentist was painful and bordering on torturous. He was scared of the drill, he was scared of the injection, and there were a lot of tears and a lot of screaming, and the dentist didn't really care to work with kids, and so it was just a bad experience. So Tommy's hid this as best he can for 2 weeks, but this morning at breakfast, he can't hide any longer the discomfort that he has in his tooth as he's chewing, and so his mother knows. But this time she's prepared. She's found Kids Dental. At Kids Dental, she hands to Tommy and says, "Tommy, we're going to the dentist." And so on the ride to the dentist, she hands him Kids Dental, and Tommy takes a look at Kids Dental, and he learns that he can learn information about the teeth and the jaw. He can learn what they're all called and how they interact. And he can zoom in and learn about the teeth and what the dentist will be telling him when he gets to the dentist's office. And then he sees conditions. And in conditions, the first thing he notices is cavities. Cavities were what he had the last time, and according to the CDC, are the most common chronic disease among children. And so Tommy starts to play with cavities. And as he does, he sees an image that is very familiar to him. He would have seen an image like this in a film, of the sort produced by Pixar. And as Tommy goes through the process of fixing the cavity, he sees in a very familiar and safe and comforting way exactly what happens, right, when the dentist fixes his teeth. And then when Tommy arrives at the dentist's office, his dentist pulls out Kids Dental and walks through exactly the same process with Tommy. And he tells and describes to Tommy exactly what he's going to be doing, from cleaning out the cavity to putting in the filling material to curing it and then to smoothing it out so that the tooth is just as good as new. And so this experience, while not pain-free, is without tears and screaming, and is a much more positive experience both for Tommy and his mother and for the dentist, of course. But that doesn't satisfy the entire problem. That handles the chronic aspect of it, but it doesn't handle the preventative. So on the way home, Tommy's mom hands him the iPad again and says, "Tommy, take a look in the Learn section." And so Tommy opens up the Learn section. The first thing he notices is that he can learn to practice brushing. Before this, Tommy had always been told, just go brush your teeth. But nobody ever told him how much time he needed to spend brushing his teeth, so he'd go up there and maybe brush, or maybe act like he was brushing, but he'd never accomplish anything. And so this showed him that it takes some work, and sometimes you have to go over teeth a few times before they'll get clean, and then the app celebrates his success. And then he goes back to the Learn section, and he learns how to floss. And as he learns how to floss, he can go in, and he knows that he has to, because the dentist told him, he has to get all of that food out from between his teeth, because that's what causes the cavities that took him to the dentist in the first place. And so Tommy learns how to take care of his teeth so that he will have to go to the dentist less frequently, and that when he does go, it will be a much less painful experience. So obviously this is a positive for Tommy, and this is a positive for his mother, and it's positive for the dentist, who has a good, new, educated young patient. Now, how did Tommy's mother find this dentist? She used the Find a Specialist feature. The Find a Specialist feature allowed Tommy's mother to find a dentist based on insurance, allowed Tommy's mother to find a dentist who specialized in children, so she avoided the type of dentist who didn't care about children, and allowed her to find one who was near her. And all of this saved her time and saved her money. And so now, we have a happy Tommy. He's resolved his problem, he's resolved his toothache, and everyone involved is pleased. Now, the lessons that we've learned in the process of creating Kids Dental. The first thing is, and it won't be a surprise to those people who are in the business of entertaining children, it is that design matters, because kids can tell the difference between things that are focused on education and things that are focused on entertainment. And by and large, there's a big gap in quality. And so we knew that the quality of our education for kids had to be on the level of Pixar, and I think you've seen that. The second thing that we learned, and this is specific to our vertical, but I think there may be some outside application, and that is you can teach, of course, about the chronic but you also have to address the preventative areas in medicine. Kids Dental solves problems for kids. It makes it a less painful experience. Their mothers are happier, and the dentists have a new and a happy customer. Thank you.
Awesome. Well done. Except for, sadly, this app, which I've seen, is just so beautiful, but when you use the Elmo is not really capable of showing it as beautifully. So maybe plug it in and show, while we get questions, actually how gorgeous it looks. Because you said design matters.
That's right.
It looks terrible on the Elmo, and I know it's gorgeous. So let's show it one more time while you do that. Questions and thoughts from the panelists? Because you did spend a lot of money on the design of
We did.
Of the 3D and everything like that. I just feel terrible that it didn't look awesome, and it will look awesome here.
So I think your design is really great. Why did you decide to do dental stuff?
Well, according to the CDC, dental caries in children are the single most common chronic disease in this country.
No, it's
So this was a huge addressable market
just do it on
for
my
that
computer.
reason. It's our first. This is the 11th patient education app that we've done. The other ones focus on things like orthopedic or sensory. We wanted to do something different, in part because so many of the members or the team members at Orca have kids themselves, and so we wanted to do something that would help their kids.
So I'm sorry, could you give us a little more background on that? You're doing, and I apologize since I'm not as familiar with you as I should be, but do you do applications for adults in health, or just give us a little more background of what you're
We do
from?
patient education for adults.
Okay.
6 of them are orthopedic. That's where we started. And we have 2 cosmetic, and then 2 are sensory, one of which I decided was best medical app on the App Store in the App Store Rewind 2011. And then we wanted to do something new. We have talented animators who can do the sorts of stuff that you saw right now. And we saw a real need with dental, especially among children. And so it was
hey,
an obvious
Max, you have some
opportunity.
ideas here? What do you think? Max, come on up. Can I call you Max, or do I have to call you Maximilian? You want to trade names? How would you like to give me Maximilian and you could be Maxim?
Do you guys have like all different not just teeth but like bones and different parts of your body?
We do. Yes, we do, actually. In fact, I think you can see there, this is the suite right here that we have currently, and there's a heart app right now waiting to be released on the App Store, hopefully out in the next week.
That's pretty awesome, isn't it? Hey, you've been to the dentist a couple times?
Once.
Any cavities?
No,
Good for you, Max.
Was it scary going to the dentist?
can't remember.
And was there a needle involved?
I don't think so.
Yeah, probably not. You brush your teeth and floss every night?
No.
Seems like a prime candidate for Kids Dental.
What happens? Sometimes you forget? I mean, you know how important this is. You haven't had a cavity yet, have you?
No.
When you get a cavity, it's really not fun. You're going to need to brush your teeth like 3 times a day, and really don't forget, okay?
Okay.
I have like 8 cavities. And then when you get older, you can get a root canal, and it's really painful. Please brush your teeth, okay?
Okay.
You promise?
Yes.
Okay. You having a good time here today?
Yeah.
Did you get to take off from school to come here?
No.
Oh, you no school today?
It's vacation.
I'm homeschooled.
Oh, you're homeschooled too? Oh, and it's vacation? Oh, awesome. Oh, and you're homeschooled. That's pretty awesome. Okay. Why don't you grab a second toy and give it to your brother? Is that cool?
Okay.
So I guess as a mom who has taken children to the dentist and who has jumped up and down and pounded and done every single possible thing you can imagine to get kids to brush their teeth, I think you still have a problem, because I think that the dental problems in America are greatest with people who are not likely to give their kids an iPad and, take them through this. So I worry a little bit, because I think you've done such beautiful work. And in a sense, as a kid, I want to go play with that stuff. Kids are fascinated with bones and
we
sort
just
of the different
heard that from Maxim,
structures
was like,
of
where's the
things.
bones?
And
Yeah.
I wanted to go and play with it, not to be afraid. And you saw the reaction here of Thomas when you were drilling. He was really nervous here. So I guess I'm befuddled as to what to say, because I think you have a gorgeous application. I just wonder whether it's going the right direction. terrible thing.
Okay, any other feedback or questions? People like it.
I really don't get it. I think it's an app that I want to exist, and CDC should publish it or they should sponsor you to do it. But I have no way of seeing how this can possibly be a business or a repeated use case unless you tell us more about your business, and that's going to be really intriguing. But
is the business the lead
what
gen
you've
for the
told
dentist
us, I
there?
don't understand.
That's right. Yeah, the business is the lead gen for the dentist. It's a very targeted lead gen for the dentist, where parents can go search based on if that dentist accepts their insurance, if they're specialized in pediatric dentistry, if they're located near them.
Right, but the friction between, if that's your goal to find great dentists or give dentists more work, there's a lot easier ways to do that. You have to find the app, you market the app, find the app, download the app, show your kids, then go in there. It assumes you don't already have a dentist. So there's a lot of things. If that is the business, I understand, but there's much easier ways to get.
Well, is that business working, or have you launched it yet?
No, in fact, the business isn't working. We've worked with a number of different dentists who help us to develop this app. And then, of course, we've done market research with other dentists, and people don't know. How does anyone even know where to go to find a good dentist? Just word of mouth, maybe, but that's reliable based on a really small data set. And so if we can go in there and if we can do some fact-finding about the dentist ourselves, which we intend to do, didn't really get into the business model. We got into the visual aspects.
I think
of it.
you're
Well,
really
let's
good.
explain the business model.
You're really good building nice apps, good, beautiful apps, 3D apps. Stick to that. Show people bones. Don't try to be a lead gen business for dentists when you're really good at building apps. That can be sold, can be educational, it can be do all kinds of other things. Dentists, doctor
you
referral
perceive
service.
parents will pay for this, and you can just.
Anytime you have a great app, like the Google app, on Android that shows you inside of the body and all that, people pay for that, of course. This is part of education. But
let's hear it for Orca Health.
Sorry.
Well done.
Okay, thanks.